Let's learn about the medical experts of hospital infection control. Particular infections should be considered healthcare associated when the fever is not present or incubating when the patient is admitted to the hospital. The infection does not represent a complication or extension of an infectious process that was present at the time of admission. The infection occurred more than 48 to 72 hours after admission and within 30 days following discharge or longer if it is related to surgical procedure. The instances are not considered to be associated with healthcare when it is associated with those infections which are associated with complications or extensions of infections already present at the time of admission, unless a change in pathogen or present in symptoms strongly suggests that the infection has been occurred after a hospital admission. Infections like herpes simplex, toxoplasmosis, cytomegalovirus, or syphilis among infants which are acquired transplacentally and manifest in less than 48 hours of birth are not considered to be associated with healthcare. Reactivation of latent infections like herpes zoster, herpes simplex, syphilis, or tuberculosis are not considered to be associated with infections. The following conditions are not infections, like colonization, that is presence of microorganisms, skin and mucous membranes in open wounds or in excretions, but there are no clinical signs or symptoms. And inflammation as a tissue response to injury or stimulation by non-infectious agents like chemicals. Healthcare-associated infections affects hundreds of millions of people worldwide and is a major global issue for patient safety. In modern healthcare facilities, 5 to 10% of patients acquire one or more infections. In developed countries, the risk is 20 times higher than in developed countries, and the proportion of patients affected by healthcare-associated infections nearly exceeds 25%. In ICUs, healthcare-associated infections affect about 30% of patients, and the mortality may reach 44%. Now, healthcare-associated infection implies a potential for medico-legal problems. Liability for healthcare-associated infection depends on whether the hospital fails to implement the basic infection control measures, fails to carry out pre-screening for MRSA or C. difficile infection, fails to provide a clean and safe environment, fails to provide basic medical care, delays in identifying and treating the infection, fails to treat or monitor the infection, and will be seriously liable for negligent or indigent failures by staff to comply with the infection control measures. The WHO recommends following to reduce the healthcare-associated infection, that is, providing direct patient care using practices that minimize infections, following appropriate practices of hygiene, protecting the patients from other infected patients and hospital staff who may be infected, and complying with the practices approved by the Infection Control Committee, obtaining appropriate microbial specimens when an infection is present or suspected. WHO guidelines mentions notifying the infection control team of all cases of healthcare-associated infection and admission of infected patients, complying with the recommendations of the Antibiotic Committee regarding antibiotic usage, advising patients, visitors, and staff on techniques to prevent transmission of infections, instituting appropriate treatment for any infection that have for anything that have breach. Taking steps to prevent such infections in staff from being transmitted to other staffs or especially patients. Patient litigation. Now, patient is wishing to sue a hospital for harm caused by health-related infection would have to prove that a reasonable hospital or hospital management would have been forced in the likelihood of harm to patient if certain steps were not taken to prevent such infection. And the hospital or hospital manager is concerned had failed to take such steps. For example, such steps may include disinfection and sterilization measures to eliminate pathogenic microorganisms and microbial organisms. It's common knowledge that in the hospital surfaces can be disinfected by applying specific chemicals, and sterilization can be done by using heat, steam, under pressure, liquid chemicals, and hydrogen peroxide gas plasma. Healthcare managers and hospitals will be held directly liable for negligently failing to implement adequate infection control measures when such failures cause harm to patients, whether or not such measures are regularly monitored. The patient must establish he or she contracted an infection in the hospital. The hospital, through an act of negligence, breached its duty to the patient and did not follow a policy or procedure to prevent the infection. The hospital negligence caused the infection. The patient condition worsened because of the infection. An intentional failure to implement adequate infection control measures means that the hospitals or the concerned had either actual or eventual intention not to implement such measures. Where such actual intention is presented, the wrongdoer decides not to provide certain infection control measures and know that it is wrong. Where eventual intention is present, the wrongdoer subtly forces the likelihood of harm to patient if adequate infection control measures are not implemented and do not care whether or not such harm results. There are several predisposing factors contributing to hospital-acquired infections. Like the objective factors associated with either an increased risk of colonization or with decreased host defense could be divided as those related to underlying health impairments such as AIDS, smoking habits, diabetes. those related to acute disease processes such as surgery or burns, and those related to use of invasive procedures or other mode of treatment. Lawsuit alleging negligence on the part of the practitioner focus on failure to prescribe to indicate antibiotics, failure to adequately screen for sensitivity, or proper release of monitor antibiotic usage. Prescribing antibiotics that are clinically contraindicated. Inappropriate use of antibiotics for surgical prophylaxis to subtherapeutic use of antibiotics. Hospitals and healthcare providers owe duty of care to the patient to provide a clean and infection-free environment. Several patients also owe duty to comply with the medical instruction both during hospital stay and afterwards. In a malpractice lawsuit, the patient may be held responsible for contributory negligence if the patient did not comply with the medical instruction, resulting in harm related to HII. For example, if a patient failed to receive recommended follow-up treatment to change wound dressings or do not take recommended antibiotic medications, the court may determine that the patient is entitled to lose quantum of compensation, ever no compensation at all. To summarize, healthcare organizations should have standard updated protocol for prevention and control of infection. Healthcare providers have duty to disclose the patient information related to any harm or hospital acquired infection to the patient or family. Greater awareness needs to be created so as to highlight the potential legal implications of hospital acquired.